I'm Dr. Marissa, and today I'm going to show you 4 nuts that may support your heart, brain, bones, and digestion after 60, and 4 nuts that many adults over 60 should be very careful with. Now listen carefully. If you eat nuts every day because you think they are always healthy, if you snack on peanuts, cashews, macadamia nuts, or pine nuts without thinking, if you have high blood pressure, diabetes, kidney problems, joint pain, dentures, or take daily medication, this video is not random. This video may be exactly what your body has been trying to tell you. Because after 60, not every healthy snack works the same way inside your body. Some nuts can support your heart, some can help your digestion, some can protect your brain, some can support your bones, but some nuts can also be too salty, too calorie dense, too hard to digest, too easy to overeat, or risky for people with certain health problems. And the most dangerous part is this: many people do not get hurt by a big mistake. They get hurt by a small daily habit, a handful here, a spoon of peanut butter there, a salty snack every night, a nut mix while watching television, week after week, year after year. Stay with me until the end, because the last nut on the be careful list is one many people think is fancy and harmless. But for some adults over 60, it can cause strange taste changes, appetite issues, and may not be the best daily choice. Before we begin, type nuts in the comments if you eat nuts every week. And tell me honestly, which nut do you eat most? Almonds, walnuts, pistachios, peanuts, cashews, or something else? We don't do fear here. We don't do fake promises. We connect the dots. Now let's begin. The first nut I like for many adults over 60 is almonds. Almonds are simple, easy to find, and powerful when eaten the right way. They are not exciting, they are not fancy, but they do a lot of quiet work. Almonds contain healthy fats, fiber, magnesium, vitamin E, and some calcium. And after 60, those things matter. Your bones need support, your heart needs support, your digestion needs support. Your brain needs protection from oxidative stress, and almonds can fit into that picture. Now listen carefully. The benefit is not from eating a huge bowl. The benefit comes from a small serving, a small handful, not half a bag, not mindless snacking, a controlled portion. Because almonds are healthy, but they are still calorie dense. That means if you keep eating them while watching TV, you can easily take in far more than your body needs. The best way is to use them intentionally. Add sliced almonds to plain yogurt. Add a few to oatmeal. Eat a small handful with fruit. Use unsweetened almond butter, but measure it. Do not eat it from the jar with a spoon. That is where healthy becomes too much. Also, if chewing whole almonds is hard because of teeth, dentures, or jaw pain, use sliced almonds or almond butter. Your food should support you, not fight you. Your action step this week: replace one sweet snack with a small handful of almonds. If you like almonds, type almonds in the comments. The second nut I like after 60 is walnuts. And if almonds are the bone and heart nut, walnuts are the brain nut. Walnuts contain healthy fats, including plant-based omega-3 fats. They also contain plant compounds that may support heart and brain health. And here's why that matters. After 60, many people start worrying about memory. They walk into a room and forget why. They misplace keys. They feel mentally slower. They worry because they have seen someone they love decline. Now, walnuts will not magically prevent memory problems. No food can promise that. But walnuts can be part of a brain-supportive eating pattern. They give your body healthy fats and antioxidant compounds that support the blood vessels and brain cells. And the brain loves healthy circulation. Now stay with me, because this is where people make a mistake. Walnuts go bad faster than some other nuts because they contain delicate oils. If they taste bitter, stale, or smell like old paint, do not eat them. That means the oils may have turned rancid. Store walnuts in the refrigerator or freezer. Do not leave them open in a hot kitchen for months. And again, portion matters. A small handful is enough. About 7 to 9 walnut halves can be a good serving for many people. You can add them to oatmeal, salad, yogurt, or eat them alone. But do not cover them in sugar. Do not choose candied walnuts and pretend they are the same. That is dessert, not brain support. Your action step: keep walnuts in the fridge and use a small serving a few times a week. If you want brain support, type walnuts in the comments. The third nut I like after 60 is pistachios. Pistachios are one of the smartest snack choices when you choose the right kind. They contain healthy fats, fiber, protein, potassium, and antioxidants. They are also easier to eat slowly, especially if you buy them in the shell. And that matters, because one of the biggest nut problems after 60 is not the nut itself. It is overeating. A person sits down with a bag. They start snacking. They do not count. They do not notice. Suddenly, a healthy snack becomes hundreds of extra calories. Pistachios in the shell slow you down. You have to open each one. You see the shells pile up. Your brain gets time to notice how much you have eaten. That is useful. Now listen carefully. Choose unsalted or lightly salted pistachios. Do not use heavily salted pistachios if you have high blood pressure, kidney issues, swelling, or your doctor has told you to watch sodium. Salt can turn a good snack into a blood pressure problem. Pistachios may also be easier to chew than some very hard nuts, but if your teeth or dentures are sensitive, choose carefully. Do not crack shells with your teeth. That is how people damage dental work. Use your fingers or buy shelled pistachios. Your action step, try pistachios as a controlled snack, but choose unsalted or lightly salted. If pistachios are your favorite, type pistachios in the comments. The fourth nut I like, but only in a tiny amount, is Brazil nuts. Brazil nuts are powerful because they contain selenium. Selenium supports thyroid function and antioxidant defenses in the body. But Brazil nuts come with a warning. More is not better. This is one of the biggest mistakes people make. They hear a food is healthy and then they eat too much. But Brazil nuts are so rich in selenium that eating too many every day can become a problem. Too much selenium may cause nausea, hair changes, nail changes, stomach problems, or other symptoms. So with Brazil nuts, the rule is simple. 1 or 2. Not a handful, not a bowl, not daily overeating. 1 or 2 Brazil nuts can be enough for many people. That is why I call them a small but serious nut. They can be useful, but they demand respect. Also, if you already take selenium supplements or thyroid medication, talk to your doctor before adding Brazil nuts daily. You do not want to double up without realizing it. Your action step, if you eat Brazil nuts, limit them to 1 or 2. If this surprised you, type Brazil in the comments. Now we move to the nuts I would be more careful with after 60. And the first one is peanuts. Now I know peanuts are everywhere. Peanut butter, roasted peanuts, salted peanuts, trail mix, candy bars, snack packs. And yes, peanuts can provide protein, fat, and nutrients, but after 60, the problem is usually not plain peanuts in a controlled amount. The problem is the way most people eat peanuts: salted, roasted in oils, covered in sugar, mixed with candy, turned into sweet peanut butter, eaten by the handful without stopping. That is where the trouble begins. If you have high blood pressure, salty peanuts can work against you. If you have blood sugar problems, sweet peanut butter or peanut candy can work against you. If you struggle with inflammation or weight gain, large portions can work against you. And if peanuts are stored poorly, mold contamination can be a concern in some settings. So I do not tell people never touch peanuts. I tell them stop treating peanuts like a harmless daily free-for-all. Choose plain peanuts if you eat them. Choose natural peanut butter with no added sugar and minimal salt. Measure the portion. And do not make peanut butter your main snack 3 times a day. A spoon can become 4 spoons quickly. Your action step, if you eat peanuts, check the label for sugar, oils, and sodium. If peanuts are your daily snack, type peanuts in the comments. The second nut to be careful with is cashews. Cashews are delicious, soft, creamy, easy to eat, and that is part of the problem. They are very easy to overeat. You start with a handful, then another, and because they are soft, the body does not always feel like it has eaten much. Cashews are also higher in carbohydrates than many other nuts. That does not mean they are poison, but if you are diabetic, pre-diabetic, or trying to control blood sugar, you should pay attention to portions. Cashews also contain oxalates, which may matter for people prone to kidney stones. So if you have a history of kidney stones, kidney disease, or your doctor has warned you about oxalates, do not make cashews a daily habit without asking. And again, the store version matters. Salted cashews, honey roasted cashews, chocolate covered cashews, cashew snack mixes, those are not the same as a small portion of plain cashews. The word nut does not erase sugar and salt. Your action step, if you eat cashews, keep the portion small and choose unsalted. If cashews are hard for you to stop eating, type cashews in the comments. The third nut to be careful with is macadamia nuts. Macadamia nuts are rich, buttery, and very calorie dense. They taste luxurious because they are mostly fat. Now, not all fat is bad, but after 60, portion control matters more. If you are trying to manage weight, blood pressure, diabetes, cholesterol, fatty liver, or joint pain, calorie-dense snacks can quietly slow your progress. Macadamia nuts are also easy to overeat because they do not feel heavy at first. A few become many, and before you realize it, a small snack has become a large calorie load. They can also be hard and dense, which may not be ideal for people with dentures, crowns, weak teeth, or chewing problems. And for some people with gallbladder problems or fat-sensitive digestion, very rich nuts can cause bloating or discomfort. So the issue is not that macadamia nuts are evil, the issue is that they are not the best everyday nut for many seniors. If you love them, eat a few occasionally. but do not make them your main daily snack when almonds, walnuts, or pistachios may offer a better balance. Your action step: if macadamias are in your kitchen, portion them before eating. Do not eat from the bag. If you love macadamia nuts, type macadamia in the comments. Now, the fourth nut to be careful with is pine nuts. Pine nuts are small, fancy, often used in pesto, salads, and Mediterranean dishes, and most people think, how could these be a problem? For many people, a small amount is fine. But after 60, there are a few reasons to be cautious. First, pine nuts are expensive and calorie dense, so they are usually not the most practical everyday nut. Second, like walnuts, they contain delicate oils and can turn rancid if stored poorly. If they taste bitter, stale, or strange, throw them away. Do not force yourself to eat old nuts. Third, some people experience something called pine nut mouth, where a bitter or metallic taste appears after eating pine nuts and can last for days. For a younger person, that may just be annoying, but for an older adult who already has low appetite, taste changes, or weight loss, this can be more serious. If food tastes metallic for days, you may eat less. And after 60, eating less protein and fewer calories can quickly affect strength, immunity, and muscle. So again, this is not about fear. It is about knowing your body. If pine nuts bother your taste, appetite, digestion, or interact with a sensitive stomach, they are not worth forcing. Your action step: if you use pine nuts, store them cold, use them fresh, and stop if they cause a strange taste. If pine nuts surprised you, type pine in the comments. Now let's bring everything together. There are 4 nuts I like from many adults over 60. Almonds for bones, digestion, heart support, and vitamin E. Walnuts for brain and heart support, but store them properly. Pistachios for a controlled snack, especially unsalted or lightly salted. Brazil nuts for selenium, but only 1 or 2. And there are 4 nuts I would be more careful with. Peanuts, because most people eat processed, salty, sugary versions. Cashews, because they are easy to overeat and may matter for blood sugar or kidney stone risk. Macadamia nuts, because they are extremely calorie dense and may be hard on weight, digestion, or teeth. Pine nuts, because they can spoil easily and may cause taste changes in some people. The biggest lesson is this: after 60, the question is not, are nuts healthy? The question is, which nut, how much, how often, and in what form? That is where the answer changes. Raw or dry roasted is usually better than fried in oil. Unsalted is usually better than salted. Plain is better than honey roasted. A small portion is better than eating from the bag. Fresh is better than stale. And your health conditions matter. If you have kidney disease, diabetes, high blood pressure, dental issues, digestive problems, allergies, swallowing problems, or take medications, your best nut choice may be different from someone else's. So here is your simple nut plan. Choose one of the better options. Measure a small serving. Eat it slowly, store it properly, avoid sugary or salty versions, and pay attention to how your body responds, because your body is always giving feedback. Bloating is feedback, thirst is feedback, blood pressure is feedback, blood sugar is feedback, dental discomfort is feedback, appetite changes are feedback. Do not ignore the signal. Now I want you to comment one word. Which nut do you eat most? Type almonds, walnuts, pistachios, Brazil, peanuts, cashews, macadamia, or pine. And if this video helped you, subscribe. Because in the next video, I'll show you the common snack mistake many adults over 60 make at night that may raise blood sugar and disturb sleep. I'm Dr. Marissa. Take good care of yourself this week. You came here thinking all nuts were automatically healthy, but you are leaving knowing that after 60, the right nut can support you, and the wrong habit can work against you. You came here with a handful of nuts. You're leaving with a map.